Now, you were pretty stoic for all those years, but you had to use anesthesia for the surgery, right?
Thank goodness.
Yeah. And your recovery, was it really hard?
It was. I mean, going into it, I knew it was going to be hard, but nobody tells you how hard it's going to be. And I think everybody here that's been through it or something similar to it, you physically, mentally think you're prepared, but when you're facing it and your body and your mind aren't connecting, and I remember looking at my toes thinking, come on, move. Come on, foot, move. And nothing was happening. It's hard. And then to deal with the pain for such a long time, your feet, I mean.
Well, you had a lot of work.
It was a lot. And then to know I had to go through it again, I'm grateful I did, because one of the things that I told him, I said, I'm single, I want to get married, I want to have a family, and I want to run and play with my kids someday. So the fact that he said, you'll get through there, it's worth it. So
that's fantastic. And you were a pretty active young one yourself.
Yeah, I was a gymnast, and I have a black belt in Taekwondo. I ran for many years and had a lot of ankle breaks, and found Dr. Buchanan through Dr. Bruno here in the McLean area, and he didn't feel like he could do anything for me, so he referred me to Dr. Buchanan and said, listen, I think you're going to need surgery, but the only person I trust is Dr. Matthew Buchanan and Dr. Neufeld. So I went to see Dr. Buchanan, and I had an MRI that was like my last exam, I guess, to show how bad my ankle was. And Dr. Buchanan, as soon as he saw the MRI, he's like, you need to have a sublateral ankle replacement surgery, right?
Yeah. You got that down pretty well, yes,
yeah.
That's for sure, yeah.
And then, and I said, and I had gotten to a point about 4 years ago where I couldn't walk anymore up the stairs. I had so much pain, and I could literally like feel I had arthritis starting in my left ankle, and could feel the bones actually rubbing against each other. So Dr. Buchanan and I just decided, let's do the surgery right away. And I went into it not really knowing how long it would take. But I had gotten to a point where I wasn't even walking very much anymore, and I was just very lazy sitting around because the pain was excruciating. And I had started to gain weight, and I just was very depressed because I was always very on the go and very athletic and always at the gym every day. So I had the surgery done, and I guess during the surgery he found out there was, I had more spurs, and he needed to clean up the ankle more. And one of the things he did was he drilled 2 holes in the front of my ankle where the cartilage, I guess, had deteriorated, and cartilage doesn't regrow, so blood flows in there, and over time it causes scar tissue, and so it kind of replaces the whole cartilage to help where the ankle was grinding against each other.
So it gives it a surface.
Yeah, do I get a job now?
Very good, very good.
And then after I got out, it took a long time. I had to stay at an incline because of where the position where the cartilage was forming. If you drop your foot or if you step on it or anything, it could mess up that whole formulation, I guess, that's happening. So thank God I have a first floor master bathroom, and my mother and I had a person I hired help me. That's the hardest recovery time, not having somebody close to you to be there for you. And I was very fortunate to have my own business, so I could work from home, because if I had to work for somebody else, I don't think I could do it.
So as a child and doing gymnastics, you were doing a lot of high force landing on your feet. You would
vault, trampoline.
You'd see them limp away after
beam.
doing something,
Yep.
and then they'd come back and do the next set.
Exactly,
and you were dedicated and committed. And
yeah, and I sparred a lot. I was, you know, I got my black belt at a young age, and I used to spar on a national team, and I broke my ankle 3 or 4 times growing up. I think it started to get weak, but I didn't really feel the post-traumatic arthritis till later, as I got older. Yeah, I still was running, but it just, over time, it just started like getting to a point I stopped running.
Yeah. So Gee, we have a pretty intense story there. Athletes will do these things to themselves. As we heard, they keep trying, keep figuring it's going to get better. When a child sprains their ankle, these kinds of things sort of start to set up. Tell us a little bit about what happens to the ankle in these traumatic situations. And she was talking about the surface and about the cartilage and things of that nature, just to help people understand what that means.
So, anytime we have an ankle sprain, what we're talking about is essentially a tearing of the ligaments that connect the leg bones to the foot bones. So, let's say in childhood, when the ankle is sprained or rolled and these ligaments are torn, we want to make sure that they heal adequately and are treated appropriately. What can happen with athletes like Mina that are into martial arts and gymnastics is repetitive spraining of the ankle can end up with ligaments that are stretched and torn such that they no longer function properly. What we worry about is that as that ankle is sprained, you can see just by this very position, we're starting to damage the cartilage that lines these joints. So that's what Mina was dealing with, is basically a series of ankle sprains bad enough that she had caused cartilage damage in the ankle.
And as opposed to muscle and some other things that you can actually heal and regenerate, the cartilage just won't do that.
Correct.
And once you do what you did for her, you drilled holes in the end of the bone so that you get some scar tissue there to give you a little cushion, huh?
Exactly. So it's a technique that's called microfracture. It's very common in athletes. So when you have a focal, meaning relatively small loss of cartilage in a joint surface, by drilling it, it promotes the ingrowth of what's called hyaline cartilage. So it's not quite as perfect as the native hyaline cartilage that grows in, but that scar cartilage is great for pain relief and for longevity of the joint.
Fantastic. Well, that's good to know. I guess I have some hope for my knees and some of the other things, but we'll find out more. Now, you had a different kind of experience.
I did. I had a very bad bunion.
A bad bunion?
A bad bunion. And when my friends and I would talk about our bunions and we would look at each other's bunions, mine was the very worst always. I won that contest every time. It took years to develop. It started when I was a young woman. The shoes that are in style now were in style then, with a very high heel and the pointed toe. And it forces your foot into a very small space. And over years, my big toe turned toward my little toe at 45 degrees. It stepped on my second toe every step I took. And one orthopedic surgeon told me that I should just buy shoes to fit my feet. Well, there were no shoes to fit my feet.
No stylish shoes,
no.
Anyway, that's for sure, yes.
And though there was a little impression of my toe sticking up there in the middle of the shoe, it became very painful over time. But I didn't think I had any recourse. Then one of my friends told me that she had had bunion surgery at the Foot and Ankle Clinic. It was a wonderful experience, and everyone rushed to tell me how very painful bunion surgery is. And of course I was worried about it, but Dr. Neufeld told me that they have better techniques now and better medication. And I was tired of having my foot hurt all the time.
It really hurt.
It did.
Yeah.
It really hurt. So I had the bunion surgery, and he was right. The pain medication took care of it, but I only needed pain medication for 3 days. And after that, I didn't use it anymore, and the recovery went very well, and the swelling takes a while to go down. It's a little disappointing to have to wait 4 to 6 months to wear pretty shoes. But
you're back to them.
I am back to the pretty shoes.
And I'm sure you know that better than anyone.
Oh, absolutely.
Yeah. So was that what she would ask you when it wasn't how the dress looked? It was how do my feet look in these shoes?
Yes.
Yeah. Until
And
she
you
got
were
them
very
fixed.
careful how you answered.
That's
looked
true.
A little
But that's
swollen.
true.